Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of the people in our community. We take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy. During this town hall, you will hear from our expert panel and welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Dohmann, Chief Nursing Officer for Mary Washington Healthcare. And third, our panelist, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. McDermott, I'd like to turn it over to you to start the program and tell our viewers the latest information about our region.
Great. Well, good evening, everybody. And again, thank you for taking a little bit of time out of your evening to tune in and see what's going on here with the coronavirus pandemic locally in our market. I'll start by sharing one of the graphics from the dashboard, which we use internally. We currently have 44 patients hospitalized between Mary Washington Hospital and Stafford Hospital that require inpatient care to help them battle COVID-19. That's down from our peak last week when we were up over 60 patients. So that's good news. And I guess my first message of the evening is congratulations and thank you to everybody who's tuning into these town halls for helping us spread the word in our community that now is the time to take action. Right now is the time to limit our interactions with others outside of our daily household unit. If we do need to be outside of our household unit, wear a mask at all times, indoors and outdoors around others. Limit the time that you spend with those other individuals if you have to do that, and practice exceptional hand hygiene. All of those tactics we know can help us flatten the curve, and that's what we are seeing here over the past week or so with our inpatient hospitalizations in our Fredericksburg region. We are hopeful that this is a flattening of the curve. We still don't like the trajectory that this curve is on from November 1st until now. It is one patient that we're treating for COVID-19 is too many. This is a preventable disease if we all take good actions to stay safe. And so we're encouraging everybody, continue those actions, keep helping us get the word out in our community. Talk to your friends, your family, your loved one, your colleagues, your peers, anybody you know in our community, and encourage them to take action now, limit their interactions with others, wear masks at all times, social distance, great hand hygiene. Those are the things that can keep us all safe. But there is some good news here over the course of the past week or so with our number of hospitalizations. And I want to thank everybody who's tuning into these town halls for helping us get the word out and for helping us have our community take action. So thank you for that.
Thank you, Dr. McDermott. We're going to dive right into a topic tonight that we know is on everyone's minds. Dr. Newman, many of our viewers have been seen on the news that Mary Washington Healthcare has received COVID-19 vaccines, and we've begun vaccinating our staff and doctors. So with the vaccine discussion happening around the country, I'd like to pose some questions to you regarding how vaccination might work here in our region. So let's start with the burning question of how vaccination is, how do our public get a vaccine?
Yeah. So at this point, per both CDC guidance as well as our state guidance, the first people that will be vaccinated are healthcare workers. They've been on the front lines this entire pandemic, and they're at highest risk. Plus, we need to protect our healthcare workers, so they're there to take care of you should you have a healthcare problem, COVID or otherwise, coming down the road. These are some great images they're showing of our first healthcare workers that received the vaccine. We at Mary Washington are committed to vaccinating our entire community as fast as we can, and subsequently protecting people as fast as we can. In fact, within a couple hours of receiving our first shipment of vaccine, we began vaccinating our associates and medical staff. And within 24 hours, we had hundreds of our staff already protected with their first dose of this vaccine. So the healthcare workers, based upon estimates that we're getting, through the government, we expect, particularly if Moderna's vaccine receives emergency use authorization, through the FDA within the next day or so. We're expecting to be able to get through most of our healthcare community within the next few weeks through January. I think at the longest is what we're estimating. And of course, these are estimates. We have to receive the vaccine in order to give it. The next tier would be essential workers. So that could be anywhere from people who are doing delivery, the postal service, police, fire, a lot of grocery workers, a lot of the people that with their job are facing the public every day to serve us as they have throughout this entire pandemic. The third tier are going to be those that are at higher risk, those at age over 65, those with some of the pre-existing conditions such as diabetes, obesity, heart disease that we spoke about. We hope that we're getting through that aspect within the first quarter of next year, so February, March, and then everybody who's healthy, really the rest of us in the community would be the last quarter, the second quarter of next year is what they're estimating. So April, May, June, and we're really hoping that, as we get to June, anybody who's wanted the vaccine will have had access to it. One important distinction to make, because we are rolling out the healthcare providers, this is not just for Mary Washington healthcare employees. In fact, some of our first people to receive the vaccine were private physicians here in our community that work here at the hospital. But we are going to be partnering with the Department of Health, and we are looking to, within the next week or so, get vaccine out to our paramedics and EMS, some of our dialysis providers, and then throughout the broader healthcare community, physician practices, some of the urgent cares, dental practices, et cetera. The skilled nursing facilities are another very high risk category, and the state is working on other parameters for them. So they are receiving vaccine as well. But right now, Mary Washington Healthcare is committed in this first wave to vaccinate our entire healthcare community, both inpatient and outpatient, and then move on to be able to get essential workers, high-risk individuals, and then throughout the entire community.
That really is a link. That really is a link to our mission, Chris, right? Which is to improve the health of our community. And so as this vaccine rolls out, we are in tight coordination with the state, looking at our regional allocations. We are devoting resources as an organization to make our community as healthy as it can be and as safe as it can be. And so we are going to be playing a role to make sure our community gets vaccinated as quickly as possible as that vaccine gets allocated to our region. It's part of our mission here at Mary Washington Healthcare.
Yes.
Thank you. And about how many vaccines have we given out, and how many more to go with this first healthcare worker phase?
Yeah, so we received approximately 1,900 vaccines in the first shipment that we received on Tuesday. We have given hundreds of those. We are actually vaccinating our staff as we speak, so it's hard to have that rolling number, but I would have to imagine that 500 to 600-ish vaccines will be deployed here really within just a couple days. So it was really a Herculean effort to stand up these vaccine clinics, and we're looking to get hundreds and hundreds of our associates vaccinated a day. If Moderna receives their emergency use authorization next week, we're hoping to get thousands of more vaccines next week, and we will just continue to protect our healthcare community as quickly as possible, and then hopefully be able to roll into our broader community as quickly as we can to protect everyone.
Thank you. And speaking of the tiering system, what are we basing that on?
Yeah, so the state gave us guidance on that, and there is a tiering system. So, 1A is healthcare workers, that's the first, and there's 4 tiers within that, and just sort of really basically it's hospital-based staff that are regularly interfacing and directly caring for COVID patients. And that's not just nurses and physicians that you would think of. It could be transporters, environmental services that are cleaning the rooms of the COVID patients, and many others. Then there's those that are higher risk. So it's really patient-facing individuals at the hospital that aren't specifically on the COVID units, but could interact with patients at high risk for COVID throughout their job. Really, 3 is everyone else at the sort of acute care hospital systems. And stage 4 is the broader healthcare community. So most of the outpatient. That could be everything from ambulatory surgery centers to dental practices. And as we said, we view this as our mission here at Mary Washington to serve our community. And we're proud to be able to deploy resources to protect our community.
Thank you. Where do you think teachers would fit? This is one of our questions on there. Would they fit under essential workers, or would they be in the general population?
I suspect they're going to be classified as essential workers. Mike, I don't know if you know different, but the state, I'm hoping, gives us that guidance as who fits into that category of essential staff. But I would assume our teachers do.
Thank you. And how safe is the vaccine? Have we seen any side effects from those that have already been vaccinated this week?
Yeah, the vaccine is exceptionally safe. That's one of the great blessings of this vaccine. It's very safe and it works very well. So very, very good safety profile and over 90%, I think 94% efficacy. So that's great news. We have had the opportunity to speak to some of our staff who've received the vaccine already. Some of them have had some tenderness at the site of the injection. A few have had low-grade fevers and maybe some body aches. Most have had minimal to no symptoms. Those symptoms, those are side effects. That's not an adverse reaction to the vaccine. That shows that the vaccine is working. It's showing that your body is mounting an immune response. And that is a normal, those are normal symptoms when your body's immune system revs up. So that does show that the vaccine is working. We've had no serious outcomes in the hundreds of associates that we vaccinated thus far.
I think that's important to keep stating to the public when they hear about those. They think that that's a side effect, but some of those symptoms after you receive a vaccine are actually very good news. It's a sign that the vaccine is working. Your body is mounting a response, and if you get exposed to the coronavirus, you'll be ready to fight it because you've built up what you need to fight it, the antibodies, right? And so, most of those things that we have associated with the vaccines that you might feel afterwards are actually good news. That means it's working for you, and it's likely to provide some protection, which is great.
And one of the myths and misconceptions we hear about is, well, will the vaccine give me COVID? This is not a weakened virus. It's not that type of vaccine. This is a vaccine that is based upon one of the spike proteins, and we've all seen that picture of COVID, but it's based upon one of those spike proteins that allows your body to develop antibodies towards COVID. So it's not a virus. It cannot give you COVID. It just allows your body to mount the immune response.
Thank you. And you've mentioned Moderna and Pfizer. These are tough words to say in this pandemic, but what is the difference between these two vaccines?
These are two essentially equivalent vaccines. For the public or people receiving the vaccine, they're very equivalent. They have a very similar mechanism. They're based upon that spike protein. They have almost equal efficacy. They're both 94% effective, and they both have very similar side effect profiles. So there are some differences in technically how we handle the vaccine. One has to be stored at 70 below zero, another at 20 below zero. They can be outside of freezers for different amounts of time. There's different ways that they're constituted, but for the public or for those that are receiving the vaccine, they are interchangeable. They're essentially very equivalent. And when people say, hey, which would you rather get? Whatever one I can get first is the one that I will take. They're essentially equivalent.
Thank you. Do we know anything about the ingredients? There's been a lot of unfortunate chatter, I think, and shared misinformation about how these vaccines are made, of what's in it, and I could react to something in the vaccine. Is there anything happening like that?
So now that Pfizer has its emergency use authorization, we do have the formal list of ingredients, and it's things that nobody would even know what they are or really care about. But there's no poisons, heavy metals, there's nothing that's going to cause autism, all the typical vaccine myths that you hear out there. There is nothing like that that is known to be harmful or toxic to humans.
Yeah, it's a protein, and it's mixed with salt water before we administer it. Really, that's what it's made of. It's just a very special protein that was developed.
Okay. Thank you. Now, with these vaccines, both of the Pfizer and the Moderna require a second shot, a booster, so to speak. What would happen if somebody gets the first shot and not the second shot?
Well, it's not recommended. The first shot will probably give you some protection. But as these vaccines were studied, they had to choose. We were coming to market so quickly because of the urgency of this pandemic. The companies had to decide how they were going to look at it, study it. And so each vaccine has been studied in a certain way. So we know it works best when it's in that way. The Pfizer vaccine, the booster occurs at 21 days, and the Moderna vaccine occurs at 28 days. Now, if you can't get your second vaccine exactly at 21 days, and if it's at 22 or 23 or 19, or there's probably some leeway there. Based upon the science of vaccines, there's probably leeway. But based upon recommendations through the FDA, we are trying to follow the guidelines because that is how it's been approved and that's how it's been studied for best effect.
Now, how soon will you have the immunity, or hopefully the 90, within that 94% of immunity? How soon do you have that?
Yeah, so we know with Pfizer that the immunity occurs 7 days after the second vaccine or 28 days after your first dose. So within a month of receiving your first dose, you've received full immunity for the vaccine. Moderna is probably similar. I don't have the formal information. We're hoping to get that out, I think any day or minute now, actually, with Moderna that's being evaluated as we speak.
Great. So we're getting a lot of community questions. So I'd like to switch over from the questions we prepared to those that are coming from our community. Dr. Newman, can you clarify, you mentioned before the how and when we might be seeing the other healthcare providers in the area get the vaccine, but can you clarify more of the how and where?
Yeah. So we will, and this is all being planned as we speak, but we will be likely setting up vaccine clinics or sites throughout a region, mostly closer to our 2 hospitals, which for convenience for individuals. And then we are going to be communicating to our broader medical community to come in and get vaccinated. We're hoping to have some, as we probably said otherwise, most of our clinical staff are completely busy taking care of the COVID patients in the hospital. So staffing will become one of the challenges of these vaccine clinics. But we have those that here within Mary Washington that do non-clinical jobs that were that are nurses that maybe now work in different administrative roles. They're volunteering. The Department of Health is supplying resources. We're partnering with them. And really within weeks, we hope to be able to stand up clinics and communicate to the public, our medical public at first, to come and get vaccinated.
Great, thank you. I'm going to flip-flop a little bit off of vaccines here and there because the questions are coming in about non-vaccine things too. So the first one is, are we considering canceling elective surgeries the week of Christmas?
Yeah, no. We are not. We have not canceled elective procedures or scheduled procedures at this point. Even when we were upwards of 60 patients, we were getting close and we were having to talk about some of those. We never intended to shut it down completely because, again, these are essential procedures that individuals need. Just because they're scheduled and they're not emergency doesn't mean they're not necessary for that person to have a better health outcome. So we're trying to avoid that at all cost. But at this point, we are full steam ahead for all the procedures. And again, the hospital system completely safe for you to come for non-COVID reasons for those procedures.
Thank you. We have a question if we are administering or plan to administer the Regeneron antibody cocktail, if that were needed. Can we talk about the monoclonal antibody treatments?
Yeah, we are using that right now. I'm proud to say we've probably administered more doses of monoclonal antibody than any other health system at this point in the Commonwealth. Kudos to our team here. When we received the medications, we very rapidly ramped up capabilities to get that medication to those in need. And for those who don't know, again, these are bamlanivimab and the Regeneron drug. These are monoclonal antibodies that kind of boost your immune system for people who are at high risk for going on to developing severe COVID If you get this medication before you're very sick, shortly after getting a positive test for COVID, you could prevent yourself from going on to requiring oxygen, needing hospitalization, needing to come to the ER, and having some of the catastrophic downstream effects. We've been able to administer dozens of doses over the last 2 weeks. So if anybody in the community, if you feel you have one of these risk factors, you're unfortunate enough to come down with COVID or be test positive for COVID, please contact your primary care provider, go to an urgent care. Most of our medical community should know how to get in touch with us to be able to schedule this life-saving treatment.
Thank you. We're going back to vaccines again. What do high-risk individuals need to do to get on some kind of a list? Is there a list or a prioritization yet for vaccination?
I think the list right now that's being prioritized is the 1A category, which is the healthcare medical personnel. That's pretty stratified. As more vaccine becomes available and we have vaccinated that community, there'll likely be more information about how to further extend into the other categories: the essential workforce, the high-risk individuals, the general public. But that's still a little bit ahead. Remember, we've only had vaccine available for a couple of days here, and so there's more to come. I know everybody wants every answer today, but it's right now we're dealing with what is the 1A category, the healthcare workforce. There'll be more information to come, and hopefully sooner. I want to be optimistic about the availability of these vaccines and hope that it happens sooner for everybody in our community.
I'm encouraged about the enthusiasm for the vaccine, though. It's generating a lot of interest in the community, certainly within our medical community, and that really makes me optimistic because the vaccination is the way out. We need to get a certain percentage of our population vaccinated to get back to life as normal. So this is the one thing that we all can do and get behind if we want to get back to life as normal here in the world and in the United States and our community.
Thank you. And are children eligible for the vaccine?
They are not. So the vaccine at this point has been approved for age 16 and over. Now, that does not mean it's not safe for children. It just hasn't been studied. It wasn't really studied on children. So that is sort of the next phases we're going to be looking at, is how do we protect our children from COVID. But right now, the vaccine is for 16 and over. The other group that this vaccine has not been studied in, and again, this does not mean it's not safe, it just has not been studied, and we cannot say, is pregnant women or mothers who are breastfeeding. I think those are other areas where you would really want to weigh your individual risks and talk to your provider before you receive the vaccine. Everyone else over the age of 16 should be considering this vaccine.
Great. Now, this one I think needs a little clarification. They were one of our viewers has said they saw in the newspaper that we are no longer contact tracing. We don't contact trace. The Department of Health does the contact tracing. So with that being said, if the Department of Health is no longer contact tracing, how are we to know if we work in a business or a school that there's been an exposure? What recommendations would we have there?
We are in a situation where this is widespread community disease. So that is why we are telling everybody to stay at home unless necessary, socially distance, wear a mask. You have to assume that in any facility you go to, there's going to be a very significant portion of people that could be infected. That is the stage we're at. We're beyond really contact tracing, unfortunately. This is widespread community spread and disease. We're seeing exponential spread in our community, large numbers of people testing positive every day. And when you look at the percentage of people that could be asymptomatic spreaders, it's of great concern. So again, unfortunately, we're beyond contact tracing.
Are we still helping the Department of Health with testing? I know we're talking a lot about vaccination, but people still need the test and still need to know whether they have it. So are we still doing that?
Yes, we're still partnering with the Department of Health doing testing. In addition, our two urgent cares have antigen testing at both sites with rapid test results. And we have also deployed that through most of Mary Washington's primary care clinics as well. So there are numerous ways through Mary Washington that you can get tested. And of course, anybody sick enough to come to the emergency room or the hospital, we're able to test as well. But for those community events, those are still being scheduled and partnering with the Department of Health, who've been great partners.
One thing that's important for the community to know as we head into kind of the winter season, the traditional respiratory virus season, it becomes more complicated even for us as a healthcare system when we have a patient presenting with symptoms, because there's a variety of conditions that they could have, not just COVID-19, but influenza, respiratory syncytial virus, a whole host of things that traditionally can make people very, very sick at this time of year peaking. And so the testing complexity for us as an organization increases at this time of year. We have some very specific tests that cannot test not just for coronavirus, but for those other respiratory viruses that we're using for patients in our intensive care unit and other areas. But I think it's important for the public to know now at this time of year, it becomes even harder for us as an organization because there's lots of respiratory illnesses that can typically occur now. It's another reason why we ask everybody take action now to make this a little bit easier for us as a healthcare system. Stay at home. Don't go outside if you don't have to around any other individuals. If you do, wear a mask at all times, indoors and outdoors. Limit your time spent. You can't be anywhere where you're in an indoor environment and you take a mask off around somebody outside of your household unit for any period of time. It's just not safe right now. Like Chris said, it's just too highly prevalent at this point in time. You can't count on contact tracing to let you know if you're at risk. You're at risk at any point in time. If you leave your home and you're around another individual, it's so prevalent, you're at risk if you're doing that. That's the mindset you have to have. Not that somebody will tell you or inform you if you were around somebody that had it. We're beyond that point now. And so it's a time for action. It's a time to limit activities. It's a time to wear masks at all time. It is a call to action time.
Thank you. Will there be a cost to our community for receiving the vaccine?
No, I believe the vaccine is free of charge. We're receiving the vaccine from the state for no cost to us at this point.
We're still working through that. There could be some cost or charging that goes to an insurance company if you have insurance or something like that in the background, but there should be no real out-of-pocket costs or anything like that. If you don't have insurance, do not let it stop you from coming to get a vaccine from us. We will vaccinate you. So that should not be a concern at all. There should not be a financial concern with signing up to receive this vaccine.
Would there be any value or consideration of antibody testing anyone who's already received the vaccine once they go through that?
That is occurring in the research trials right now, but there's no reason to do that in the general public. So just get vaccinated. But as they are studying these vaccines, they are looking to see how long that immune response may last. We don't know that answer right now. At this point, we're hopeful that this vaccine lasts 6 months. It may last longer than that, but we just don't know. This may be an annual vaccine that we all need to receive. It's very unclear, but there is no use of getting antibodies following your antibody test following your vaccine.
Thank you. Where would people with autoimmune disorders or maybe immune suppressive treatment fall in that vaccine tiering?
They're in the high-risk individual category. So they would be after our essential workers, they would be next.
Thank you. And how are we doing in our ICU capacity right now?
Eileen, you want to talk about that?
We're actually well within our capacity. And as when Dr. McDermott showed the numbers, now that we're down in the 40s, we've seen that decrease in COVID patients in our ICUs as well as our COVID cohort unit. So overall, the volume of COVID patients in our hospital has gone down, and we're well within our capacity in all areas.
Thank you. Some of our viewers are hearing concerns that the vaccine affects fertility. Do we know if this is rumor?
I saw a study today that COVID affects fertility. So they've been studying those that have had COVID, even very mild symptoms of COVID, and it can affect fertility down the road. But there's no data that I saw from the vaccine trials regarding the vaccine causing fertility.
Thank you. Do you need the vaccine if you've already had antibodies or had COVID already?
Yes,
Yes.
the vaccine is recommended for everybody, regardless if you've had COVID or not.
There are a lot of questions about convalescent plasma and other treatments. Can you talk a little about what's helping the treatment for folks who do end up in our hospital?
Yeah, at the early stages of the pandemic, a lot of these treatments were all we had, and a lot of them, the effect is pretty modest, quite honestly. So I think steroids, continue to be one of the mainstays of treatment for some of those in severe disease. Obviously, proning, which we've talked about before, to help the lungs aerate better, and that's sort of where we take patients and flip them from their stomach to their back to kind of help open up the lungs. There are various things like that, but other treatments, remdesivir and others, not as profound in effect. Right at this point, we're focusing not only on just the basic public health measures to prevent people from getting sick, as we've talked over and over again, the social distancing, masking, staying home if possible, but the monoclonal antibodies, I think those have shown a significant promise to protect people from going on to more advanced disease, and then vaccination. I think that's a big part of our focus. We have gotten better at caring for folks in the hospital and who have gotten sicker. We see the mortality rate drop as long as we're within our health system's capacity to care for individuals. I think our health teams have learned how to manage this illness, even the very ill. But that being said, I think a lot of the initial medications and treatments, modest effect is what it appears to be.
Okay. So with the vaccines, we know that in the beginning, we said this last week, but it's probably important to reiterate, it's not time to remove the masks, even though we've had some vaccines done. But down the road, will we get to the point that maybe we won't need some of these precautions that we've been using?
Yeah, go ahead, Mike.
I was just going to say, now is not if you get your vaccine, it doesn't mean you don't wear a mask anymore. Number one, just think about that publicly. Others around you don't know if who's vaccinated, who's not vaccinated. And the prevalence is so high in our community, we have to take those actions to protect one another, right? We have to do that. The point in time where we get back to what, if you want to call it normal or what used to be, is when the prevalence is so low in our community. We don't have hospitalized patients, the testing rate is very low, and we just know people aren't coming down with COVID-19 anymore because the prevalence is so low in our community. Those are the times when we will get back to some semblance of normalcy. We will know what the prevalence is in our community because of the way patients are presenting, getting tested, and the resulting of those tests. We'll know that point in time. It's not today, and it's not anywhere in the near future. If anything, I use that fire analogy. It's like a forest fire right now. It is raging hotter than it's ever been. That's the point where we are in our battle with this forest fire. It is the hottest it's ever been through the whole pandemic. So we don't change any of our tactics now. When it goes down to a little bit of smoke over in the corner, no more flames anybody can see, those are the times when we can get back to start talking about being more normal. But it's not where we're at today. We're in the middle of the forest fire. It is raging.
Yeah, we're a long ways off, and I think a lot of this will be in the community's hands. If there's widespread adoption of the vaccine within our nation, we could see that. I'd say the earliest you're going to be looking at is the fall, if there's widespread vaccination adoption, and if we see that prevalence of disease in our community go down.
Thank you. And do we know enough about the virus and the vaccine to really understand what long-term effects might look like?
Well, there are more and more people that are becoming classified as long haulers of COVID. I'm seeing statistics of upwards of even 10 or more % are having a long-standing side effects and symptoms from COVID, and we don't understand that. That could be anything from long-standing loss of taste and smell to fatigue to chronic body aches and pains to this mental fogging where people are having difficulty concentrating. And we're seeing that months and months and months after somebody's been ill. Chronic respiratory issues, chronic cardiac issues. So I think there's a lot we don't understand about it that time will tell.
Remember, the virus is just coming up on its birthday, its first birthday. So how can we know what the long-term effects are years out from now? Like the virus hasn't even been around for that sort of period of time for us to know. So very, very difficult to know. We do know the science behind the vaccine and how it's being produced, though, and how it functions in the body. And we do know those efficacy profiles and the safety profiles that we've seen from those trials. It looks extraordinarily safe.
Great, thank you. Will hospital employees who refuse the vaccine still be able to work?
Yeah, the vaccine, we are strongly recommending it. It is not being mandated.
We're seeing really good demand for the vaccine with our healthcare personnel, though. They're very excited about this. Chris, I think you used one of the best lines of the week when you said, we got a delivery of hope when it showed up on Tuesday, right? That was a delivery of hope, and it was been a long time coming for us as a health system. And I think so many of our associates that work here every single day really felt that sense of hope, like this, like, hey, we can see a light at the end of the tunnel here now, and just very thankful and grateful for everybody that's worked so hard to get us to this point in time where we could receive that delivery of hope.
Our healthcare workers are face to face with the tragedy that this disease has wreaked on our community every day. They see what this virus can do. They have a deep respect for this virus, and they want to protect themselves and the community. I fear that there's too many folks out in the community who say, "Oh, my neighbor had it, they got better. It's not that big a deal." This is a big deal. So many people get very, very ill. Are requiring hospitalization, ICU levels of care. This is not something that should be messed with. And our healthcare workers, they understand that. They're face to face with it every day.
And with that, it's almost a year. We're getting close to a year of isolation and kids out of school or in hybrid models and changes to the way that we live our lives. Are we seeing increased mental health issues in our community as a result of that? Eileen?
Absolutely. Yeah, market increases in patients coming to our emergency department. At Snowden, our volume is very high. What we've seen is that folks that have behavioral health conditions that we're trying to manage themselves during the period, with the isolation and social distancing, and just not doing well, but putting off coming to the hospital. So we've seen some very, very significant behavioral health issues. It's also important, to just remember that the statistics that are reported, across the country, 1 in 4 people will suffer from mental illness or substance abuse during their lifetime, and oftentimes, close to 2/3 of them won't seek treatment because of the stigma. And so we see that often. And so we've seen where there have been people with history of behavioral health that come to us because they're sick medically. And then we're learning that they've been ignoring their behavioral health needs because of the quarantining or isolation or just the fear of coming in contact with COVID. So yes, in our emergency departments, at Snowden, in our hospitals, we've definitely seen a marked increase in behavioral health concerns. And it is something for our community to be mindful of. When people are at a place where their behavioral health concerns are getting in the way of normal activities of daily living, that's a key sign that intervention is needed, that seeking your primary care physician, seeking follow-up is absolutely critical. And if you are someone that has a behavioral health condition, or know if someone has someone in your family and they're on medications and not taking them, that's what we're seeing, is that people that have tried to self-manage for a long time and it's not gone well, and then it's taking us even a longer time to get them back to their baseline and adjusting medication. So very significant behavioral health concerns in our community.
And I think we're only seeing the tip of the iceberg at this point. I think the effects of this will be very long-standing, and we're not even going to be able to understand it until a year or two from now. I worry about children. It's one thing for me to take a year out of my life when you're in your 40s, but developmentally, when you're taking isolating a 5-year-old or an 8-year-old, and the issues with school, and our schools provide so much social support for children and so many families that has been lacking. And then just all of us, the isolation, we're seeing very significant increases in alcohol use and a lot of other things. So I think we don't even know the start of what we may be dealing with from a behavioral health standpoint down the road.
Thank you. Have we, to transition a little bit from that, what's the flu season looking like? Is it coming in? Is it happening?
Been very mild.
Yeah.
Yeah, it's good, Eileen. Yeah.
Yeah, it's been mild. We've had cases, of the flu, but the cases have been a little bit lower volume than what we normally would see by this time of year. And those folks, people that are coming to us that are being hospitalized with the flu, not quite as sick as we've seen in past years as well. So it's looking to be mild. Now, maybe that's being helped by the social distancing and the masking, because just like if we can prevent people from sharing COVID, maybe we're preventing people from sharing flu.
Mm-hmm.
But yeah, so far it's been light as it relates to flu season.
COVID's more contagious than the flu, much more contagious than the flu. So I think as you know, the social distancing, the masking, all those things we're doing for COVID are likely helping keep this flu season at bay. Widespread adoption of flu vaccine, at least within our healthcare workers, has been very important as well.
Thank you, everybody out there. Thank you, everybody who got the flu shot, and it's not too late to get one.
It's not too late. I was going to ask that question. Can you still get a flu shot? So the answer is yes. And if you've known to have been exposed to someone who is positive, how long should you quarantine before being comfortable that you didn't get it?
Yeah, there's some recent guidance on this that may have changed a little bit. So there's some options. So if you get exposed and you know the time of your exposure, a high risk exposure, at day 5, if you get a COVID test at day 5 following your exposure, and that test is negative, you can stop your quarantine around day 7. So that's what's felt. They are also now decreasing quarantines to about 10 days. Most people develop symptoms anywhere from 2 to 7 days following that exposure. That's the vast majority of people will. There are some people who will go on as far as 14 days. So if you need to shorten your quarantine by any means, for specific reason, you can get a test at day 5. And if that's negative, you can release your quarantine at day 7. So there's some changes recommended by the CDC that are pretty new.
Okay, so we actually have ended our community questions. So I'd love for us to start wrapping up. So I'd like to start with you, Eileen, if there's any message you'd like to send to the community or any news you'd want to share with the community about what's happening here.
I think just the message that we've shared before is, supporting healthcare workers. We had a pretty exciting event this week, something that we're celebrating. So one of our nurses, Stacy Mason, a nurse in the Mary Washington Hospital ICU, was actually on the Rachel Ray show this week. Very early on in COVID, Stacy was noticing in the ICU that shifts were longer, than usual. People were picking up extra shifts. There was so much we didn't know about COVID. Everyone was very, very cautious about taking COVID home to their families. So showering and laundering. And so what they found is that people were having a hard time just doing basic sort of activities like going to the grocery store, picking up things that their family needed. There was also fear that they didn't want to go into the grocery stores. So what they started doing in the ICU is if somebody did go to the store, they picked up extra stuff and they would bring it in and they would sort of swap and help each other. And so it happened to be around Nurses Week, and we usually come up with some collection sort of activities across nursing. And Stacy very aptly said, why don't we collect things for our associates, the nurses, and all of our staff and our providers that are here every day taking care of COVID patients? They could probably use the help. So we put the word out. She called it the pantry, and it was very much like a lending library. If you've got something to leave it. If you see something that you need, take it. It was set up specifically outside in a hallway where staff traveled to get to the parking garage, so it was easily accessible, and it took off. It was hugely successful and continued to grow. And then we've now expanded it to 3 locations across the health system. And so Stacy was on Rachel Ray this week to tell that story. It's a permanent part of our organization now. It's called the Associate Cupboard. And there's locations around all of our facilities where people can drop things off. And then everyone knows where the 3 sites are that if you need to pick something up, you're certainly free to. And I guess probably the most significant impact is, yes, it's helping people who are super busy or, just picking up extra shifts and working extra hard at work. But we've also had a number of our associates who have really been hard hit financially because of COVID. And there was one where somebody had put some baby food into the pantry, and one of our associates left a note and said, "You have no idea how much of a difference this made to my young child today." So it's really been just very uplifting. And so we were pretty excited to now have a famous Mary Washington Hospital ICU nurse. But it really does drive home the message of healthcare workers and the people that have been on the front lines and taking care of COVID patients now for what is almost 11 months. So if you know a healthcare worker that is involved in a hospital taking care of COVID patients, or just in a hospital helping us take care of our community, show them the love. Let them know how special they are, because they come to work every day and all they want to do is make a difference. And what Mike and Chris said earlier is true. They are acutely sensitive to making this stop, because they've seen more than anybody the worst side of COVID. They've seen what it does. They've seen the devastation, and they want it to stop. So my last plea, after you love your local healthcare worker, is please don't give up your vigilance. Wear the mask, wash your hands, socially distance. If what we've seen in the last couple of days, the decrease in our census is because of that, then thank you, but please don't stop, because it's still too high. And we're coming up on Christmas. There's that temptation again to get together. Please don't. We need to get through this, and we need your help.
Thank you, Eileen. And Dr. Newman, final thoughts?
I'm just so excited to finally have the vaccine here. It really is a remarkable testament to modern science. And it's just great to see the enthusiasm and now optimism in our staff and our healthcare workers that have been working so hard to protect our community and care for our community since this has all started. On the first day, some of our frontline workers had tears when they were receiving their vaccine. Some were tears of relief because they were so scared of getting sick or bringing it home to their families. Other tears of joy because it's the first signs of hope, really, that we have in this pandemic, and for all of us to get back to some semblance of a normal life. So it's been an optimistic week.
Thank you. And Dr. McDermott, closing thoughts.
My final part of my closing thoughts is going to be starting with a shout out and a thank you to our marketing and communications team, Lisa Henry, you, Karen Charney, Emily Thurston, everything you guys do to help us pull off these town halls. There's a lot that goes on behind the scenes technically, and a lot of organization to make these things look so seamless, and you make it come off so beautifully. And we're so thankful. The impact you're having to our community is a great impact. And so thank you guys for everything that you do. And then last, we're heading into the holiday season here, the Christmas holiday, the New Year's holiday. And so for everybody out there, I want to thank you for watching. And one more time, I'm just going to implore you to be exceptionally safe this holiday season. Spend it with those in your daily household unit. Leverage technology, FaceTime, Zoom, all the technologies we have available to reach out to your extended family and loved ones this holiday season. We need to do this one more time here, as we have the light at the end of the tunnel with the vaccine and other things that really do lend a ray of hope for all of us. So I thank you for all of your actions and tactics heading into this holiday season, everything you're doing to help keep our community safe and healthy.
Thank you so much. And thank you to all our panelists. And thank you for our viewers for watching and tuning in to our community town hall. As we go into the holiday season, you may still have symptoms. We know that there are a lot of you that are still coming down with COVID-19. We saw those numbers going up. We have the Rappahannock Area Health District continues to host free COVID-19 testing. You can visit their website. We have their calendar up for the rest of December. You can see there are still a few more dates on their calendar for the remainder of the year. Please visit their website to learn where you can go for free testing. If you are having symptoms and you're not sure where to seek care, you can always call our Mary Washington Healthcare free nurse triage line. Our HealthLink nurses are available daily from 6 a.m. to midnight to talk with you about your symptoms and offer you care advice. And finally, we will be hosting one final town hall before the end of 2020. The light at the end of the 2020 tunnel. On Tuesday, December 29th, we're going to skip a week and get back with you on Tuesday, the 29th at 6:30. So you'll hear from our panelists to see where we are heading into the new year. So as we continue through the holiday season, we ask that you please stay safe and healthy and have a wonderful night.